Awesome. Thank you so much. Here, let me get my screen ready. Awesome. Okay, can everyone see that?
Yes.
Perfect. So as I said, my name is Chanbei Kudi, and I'm super excited to be here today. And I just first of all wanted to say thank you so much for being here and also being able to know the importance of mental health and come here to learn more. It's really impressive, and I'm so proud of you for being here. Okay, so I want to talk about my story of as a teenager going through school and all the stress and anxiety we put on and being able to get out of that and how my journey through moving from Ireland to the US about 4 years ago and how that completely changed my life and how I'm now back to school and getting everything all sorted out and like going through my mental health journey with all those coping strategies. So as I was saying, about 4 years ago, I moved from Ireland to the US. And this was really hard and challenging time for me because I was 9 at that time, and having to go through such a big change was really difficult because I had to change school, change friends, and like just completely come to a completely new place where I don't know anything about it. And that was really tough for me. And I never went through any of these emotions of anxiety, stress, or overwhelm in Ireland. So coming to this place, everything new was a lot of challenges which came with it. So when I was going to school, the first day of school, I remember sitting down and like having no friends. And since I'm that like outgoing and social person and love having friends and talking to them and leaving all those friends that I had a good connection with, and coming to this whole new group of people, trying to like express myself and like trying to make friends was really difficult. And knowing that since we we're in fourth grade, like everyone already had that group of friends, that was a really difficult time for me. And then having also that school culture and like changing school, changing assignments, coming midway through the semester, and that was really tough, but thankfully I had a really nice teacher who was able to help me through the way of adjusting to American school. So even though there were so many challenges and emotions, like I just couldn't handle that, and it was all so new for me. So like one day I just couldn't contain all those emotions and suddenly burst out crying. So after this, I was able to calm down from crying, and then my mom came to console me and said, "It's okay, and let's go through a quick mindfulness." So she told me to close my eyes and she started guiding me through mindfulness. This was imagining clouds, rainbows, and just different animated things in your head. After the 5 minute mindfulness was done, I felt a lot calmer because I wasn't thinking about who to sit and who to have lunch with the next day. I was able to calm down, be in my own space, and just have some fun imagining different things. And I remember she was the mindfulness teacher at a club in school in Ireland. And like she did these when I was like 7 years old then. And they were really helpful, but like I never felt these emotions of like such big emotions, overwhelmed, anxiety, stressors, all those things weren't there then. So it was just like a fun thing to do to relax. But now that those things were happening and I had that solution, it was mind blowing that there was something there that can help. So after explaining that to my mom, she suggested some more coping strategies like belly breathing, square breathing, all those different strategies that you may have heard before, and a lot more. And as the days went by in school, I tried to use this and like I really hanged on to those coping strategies, and it really helped in my journey. And then knowing this later that I was helping in my mental health journey as I was getting used to the whole new culture and everything, I was seeing and observing a lot of other students not having these coping strategies. And they were like going through school, like nervous free quizzes and those things. And I just noticed that, especially online during COVID, where we're all battling the isolation factor, not having the one on one with teachers and just feeling all at home, like stressed out about assignments. So being able to have those coping strategies, I was able to see other students who didn't. And when I was in middle school, sixth grade, I was looking at this and I really felt there was something missing. So I decided that I wanted to create a space for students to be able to share emotions and hear others share their emotions, share coping strategies and listen to other coping strategies, as well as have guest speakers come and talk to inspire youth and like to inspire us after a stressful day, just having like a decompression, like calming zone. And when I started a club in my school, where my counselor helped set it up, we were able to have that space where people felt like they were heard, and also just like a nice space you would always wish for like after school to like not think about school but also have that fun time that everyone deserves. So when I had that and shared coping strategies, the students were saying how much it helped them, and like now they have that power to be able to help themselves. Hearing that, I was really amazed that little things like this can actually help people in their lives, and I felt really inspired to share this with a bigger audience. So that's why I decided to write my book, because I was like, what's the best way to reach a bigger audience and help them more through just sharing coping strategies? So I decided to write a book through it and share it with students. And now I work to help students in schools and everywhere be able to have coping strategies. And I have messages I want to share to those students and all those people out there struggling with mental health and even mental health day-to-day challenges. One of them is you're not alone. When I heard those, when I saw those friends and like those people in school going through emotions and going through their mental health challenges on a daily basis, it made me feel like not that singular person in the whole entire globe who was going through that challenge. I was able to feel understood and heard, even if the situation, their experiences aren't the same, that they still do go through mental health challenges, and that seeing them go through them, I realized there is hope to go to get help, because a lot of people do go through them on a daily basis. So knowing this, I was striving for coping strategies and helping more students get those coping strategies that I was using to help me. And I feel like being able to say you're not alone to students, even though it's maybe just a couple words, it can have a big impact. Another thing is, even though there's a stigma surrounding mental health, we need to talk about it. There's a lot of misconceptions, and this is not your fault, because we don't know that much about mental health. It's not talked about that much in schools or with our friends. It's like we go through it on our own. That's why it's important to know that you're not alone. So being able to say, okay, there are mental health challenges, illnesses, and why don't I learn about them is really helpful, because if you don't know a subject, it's in like all the school, you have misconceptions, and then maybe you don't want to talk about it because you're not sure what it is. And that's mental health and what it is right now. That's why there's a big mental health stigma surrounding it. But by breaking that stigma, we can break the stigma by educating ourselves. And it's perfect today because Ms. House is going to be sharing about anxiety and depression. And I really hope you get something out of that as well, being able to help yourself and help others. So here's the next slide. Yeah, just a couple more things. One more important thing is mental and physical health are equally important. And like an example for this is, if there's a person, they see someone else like scraped knee and like blood is coming out, they would definitely like go up to them and say, are you okay, and ask them. But right now in society, when someone is crying or even like melting down, having a hard time inside, you're not able to see it. But being able to help others, even if you sense a little difference and they're going through some stress, being able to sit down and ask them you're not alone, and just telling them that it's okay and how can I help, showing empathy in that way is really important. That's what we're all here for, to look out for each other. And I hope you got some of these tips to go at home, being able to know mental health is important and you're not alone. So thank you so much. And here's a quick thing about my book, and then how you can order it through Amazon and my website and my social media as well. Thank you so much for listening, and I hope you got some takeaways. And let me know if you have any questions in the questions and answers below.
Thank you, Tanvi. And I did put in chat that Tanvi and two other students are going to be having a student panel next Wednesday. That will be virtual. We will have the information sent out via Parent Square and then a reminder. And then you can also look on the website. We'll have information there hopefully by tomorrow. And that will be more for students. I would highly recommend it for intermediate, so upper elementary, and then middle and high school students. I'm sure it's not inappropriate, but it might be above the level of, second, third graders. So probably your fourth, fifth graders would be okay. And then definitely middle and high school. I think this would be a great resource. So thank you so much, Tanvi. And we're going to hand it over to Chelsea.
All right. Yeah. Thank you, Tanvi. I am going to share my screen. Okay. Perfect. All right. So we're just going to jump right in here. So supporting students with anxiety and depression. I've prepared this presentation to kind of go over just from my perspective, some of the pretty critical elements, questions that I often get asked from parents. So we're going to go through kind of some causes and current concerns about mental health for teens and our young kids. We're going to talk about diagnostic criteria and some symptoms that are specific to youth. We're going to do a very simple kind of brief dive into neuroscience of the teen brain so we can understand what exactly is going on. We're going to talk about treatment options that are available for your kids. And I think why we're all here, is how to offer support. So before we dive into that, just to give you a little bit of information about kind of my background and my training. Again, my name is Chelsea House. I'm a licensed mental health counselor. So I have been working in the field for about 15, 20 years, and I have worked with teenagers throughout that whole time. So I have a bachelor's in psychology and social welfare, as well as a master's in clinical and mental health counseling from the University of New Mexico. I started my career working as a treatment therapist in a residential treatment center. It was with adjudicated youth. So I was working on a unit with teenage boys who were on probation and really could not get off of probation. They really needed to learn kind of skills to function in society. So I was able to facilitate like a weekly individual counseling, group counseling, family counseling. Most of these boys were there for about 8 months to a year, so I got to know them very well. I then moved to an abuse and neglect unit at that same facility. I was the therapist at a house of about 15 teenage girls who had been removed from their home due to abuse and neglect. Got to do some pretty intensive trauma therapy, helping with just daily regulating emotions, helping them so that they can go be more independent. I also worked at an advocacy center. It was an amazing organization. It was a nonprofit that allowed me to provide free counseling to children and teens who had experienced physical and/or sexual abuse. I learned a lot of great skills from working with younger kids, being able to do play therapy, art therapy, music therapy. I still use a lot of those skills with my teens today. Then I shifted to the Juvenile Detention Center in Detroit, Michigan. It was a highly secured, pretty intensive treatment. It was a new program that focused on trauma-informed care, because we saw this huge number of kids in detention who had pretty extensive trauma histories. So a lot of them were involved in gangs. They were getting in trouble with the law, but what they really needed was trauma counseling and learning how to regulate those daily skills and the emotions. Some of the greatest kids that I've worked with. It was a wonderful experience. Then I moved to Washington in 2018. I now have a private practice in Bothell. It's called Empty Hands Therapy. And like I said, I work at Woodinville High School. So as we kind of jump in here, I wanted to share this, the Youth Risk Behavior Survey. It was published from the CDC, so the Center of Disease Control, and we, just gonna move this. It studied these specific behaviors with teens from 2011 to 2021, and the results were very concerning. I think as a clinician and working in the field, I have seen such an overflow and such a need go up for people who are seeking services. In a way, it's fantastic because people are reaching out, but there's just not enough. There's not enough therapists. There's not enough people to really fill this need. And this report really confirmed a lot of what that experience was. I think one of the big concerns, if we're looking at some of this data, it talks about, so in 2021, more than 4 in 10 students felt persistently sad or hopeless, and nearly 1/3 experienced poor mental health. And then more than 1 in 5 seriously considered attempting suicide, and 1 in 10 actually attempted suicide. These are like extremely concerning numbers. That is higher than it has ever been. And it also shows that this mental health with adolescents is continuing to worsen. So I think that is a really important piece of why we're here, because we're noticing how immense this need is and what we can possibly do to try to help. I also just wanted to share this article. I actually stumbled upon it as I was making this presentation. It was published last Thursday, and it looked at the effects of the COVID-19 pandemic on teen brains. Kind of a study that started to look at teenage brains pre-pandemic. The study initially actually got shut down because of COVID. So they later shifted it and said, why don't we look at these kids' brains after the pandemic? And what they found was pretty significant. And we're going to talk a bit more about these layers in the brain later, but I wanted to put it here and just kind of give an idea of what we're seeing, and that there's actual evidence in the brains of what the pandemic is really doing to some of these kids. So a big piece is that these brain scans showed that parts of the brain involved in memory and emotion were thicker in post-shutdown teen brains, so higher activity in the emotion center. The area involved in executive functioning, such as self-control and problem solving, that was thinner. And on average, the brains of teens who went through 10 months of pandemic shutdowns aged around 3 years. That is huge. So we are seeing teenagers' brains maturing very rapidly, but they're still stuck in this highly emotional teen kind of brain. So they don't know what they're working with. So lastly, this premature aging is similar to changes that happen in brains of teens who experience violence, neglect, and family dysfunction. Okay, so in terms of kind of going off of the COVID pandemic, we want to talk about some risk factors for anxiety and depression. I have a list here. It is not an extensive list. This is just kind of some of the more common risk factors. So we have genetics. So anytime there's a family history of mental illness, that can be indicative that they are vulnerable to it. Environment, so we know poverty, growing up in any kind of traumatic situation, domestic violence, substance use. We also just have stresses of puberty and brain chemistry, academic stressors. Social media is a huge one. Bullying. I also wanted to talk briefly about, so the ACEs study, which is also from the CDC. This is a very well-known study. It was a long-term study that looked at these adverse childhood experiences. A list of that is, they looked at 2 specific groups of children. Some of these children experienced a wide variety of these adverse childhood experiences, and the others did not. They followed these children throughout the course of their lives, and they looked at what they looked like in their 20s and 30s and 40s. And what they found was this really significant data that supports that if children go through these adverse experiences, it significantly increases their risk of having health problems, mental illness, and substance use in adulthood. This has a tremendous impact on their future and lifelong, opportunities. What is really important about this study is that it really helps us focus on prevention. If we know that these are risk factors, we can really start to understand how to recognize vulnerable youth and understanding how we can prioritize intervention so that they don't have an adulthood of these continued issues. Okay. So from a clinical perspective, we're going to talk about diagnosing anxiety and depression. So when we talk about these are serious mental health conditions, and they do require a medical diagnosis. I hear a lot of people say, oh, I'm depressed and I'm anxious, and they very well might be, but it is important to have a clinical diagnosis and make sure that we diagnose first and then we understand how to treat it. These diagnoses often co-occur, especially when we're talking about just the brain chemistry of anxiety and depression. There are a lot of similarities that often I like to think of them as kind of evil twins. Sometimes anxiety will be driving the bus, and sometimes it takes a back seat, and then depression will kind of come in. I think an important piece that I would like to talk about is, how do you differentiate between a medical condition of diagnosing anxiety and depression versus just normal mood swings that teenagers have because of hormones or stress? So the biggest things we want to look at the intensity of their symptoms, the duration of the symptoms, and the impact on their level of functioning. And we're going to go through that a little bit more. Okay. So as clinicians, we use the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5. So this is where we gather the criteria and the data in order to actually provide a diagnosis. So in terms of anxiety, we're going to talk about generalized anxiety disorder. There are other anxiety disorders, but for the sake of kind of keeping it simple, we're going to just focus on this one. So it is characterized by excessive anxiety and worry occurring more days than not for at least 6 months. So when we're looking at intensity and duration, it's going to be excessive anxiety for at least 6 months. It's a pretty long time. The anxiety and worry are associated with 3 or more of the following 6 symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, sleep disturbance. Okay. We're also going to look at diagnosing depression. We're going to talk about major depressive disorder. Depression is a mood disorder, and it is characterized by feelings of sadness, low mood, loss of interest in usual activities. They must mark a change from a person's previous level of functioning and have persisted for at least 2 weeks. These feelings are also accompanied by at least 5 of these other symptoms. So depressed mood, diminished interest, significant weight loss or weight gain, slowing down of thought and reduction of physical activity, fatigue or loss of energy, feelings of worthlessness or guilt, inability to concentrate or indecisiveness, and recurrent thoughts of death or suicide. We are going to talk more about these recurrent thoughts of suicide, but it is important to recognize that suicidal ideation is a symptom of depression. It really comes with that territory. And so that's a really important piece when we're working with teenagers. So medically speaking, anxiety and depression in a teen brain is the same as an adult. It's the same chemical makeup. It's not anything different. But what is different is the symptoms and how they present themselves in teenagers. So we're going to look at kind of what that looks like specific to teens. So it's still going to meet the same criteria, but what it looks like. So for symptoms of anxiety, there are a lot of physical symptoms that may include pain or pressure and heaviness in the chest, muscle tension, sweating, shaking, or other fight or flight responses, accelerated heart rate and breathing rate. Often they'll complain about stomach aches or they feel nauseous. And then mental symptoms can include continuously thinking about a problem or a situation, feeling the desire to escape a situation, worrying about either the present or future, and having persistent thoughts or fear of death. And then we have symptoms of depression in youth. So a lot of these are pretty consistent with the criteria, but some of them do pop out as being a bit different. So feeling sad, hopeless, or irritable. We see a lot of irritability in our teens, not wanting to do or enjoy fun things, especially if they once enjoyed and wanted to do these things. So we see those changes in eating, sleeping, energy, having a hard time paying attention, avoiding friends or social contact, being aggressive or antisocial. These are pretty big ones. So if they start missing school, getting in trouble with the police, fighting or stealing, those are can be a real good indicator that something is going on. And then also showing self-injury or self-destructive behavior, which we're going to talk about kind of briefly next. I just wanted to kind of demonstrate a bit of like the intensity of the duration. So, it's very normal for teenagers and for adults to have ups and downs. We all are going to feel stressed. We're going to feel anxious. We might even feel really down. But the biggest piece of that is if you notice that it's happening consistently. Is it a change to how they were acting, a month ago? If you have a child who's feeling really anxious about a test, there's a lot of buildup, they're feeling really nervous, maybe they're not eating and they're not sleeping, but the test comes, they go back to eating and sleeping. They might start to worry about the next test, but generally they're able to function the same. If you have a child who is anticipating a test, is not eating, they're not sleeping, they're kind of constantly focused on it, you kind of notice that they're pacing or kind of overthinking about it. Let's say the test comes and that anxious feeling continues, that would be a pretty good indicator that they might meet some criteria for anxiety. Okay. So I just want to briefly talk about self-harm. This is very common with teens. I also understand in a lot of work with parents, this is really scary and it's hard to understand. It can be heartbreaking and it can be hard to understand how to support a teen who is engaging in that behavior. But I do have a lot of experience working with these kids who have experienced it, and things that they've shared have been helpful. So just to define it, self-harm is when people deliberately hurt themselves, and it is a way of coping with painful or strong emotions. It is not a healthy way of coping, but it does help them cope. Some of the reasons that they might engage in self-harm, they express that it's an attempt to control or stop a feeling. If they're feeling this very intense, difficult feeling, self-harm can kind of help distract from that big feeling. They say that it can be a way of trying to heal themselves. If they're feeling this immense emotional pain, they don't really know how to tend to it and face it. But if there's a physical representation, that is a way for them to kind of try to heal and be loving and caring to themselves. And then also trying to feel something rather than nothingness or emptiness, and a way to express feelings of hopelessness or emotional pain. The most important piece is that it is generally a sign that a person is in very deep distress, and you might hear that this is a cry for help or seeking attention. And honestly, I would still pay attention if this is their way of asking for help. If I ever meet someone who is self-harming, I want to listen to what's going on, because they are hurting and they really need some support. So just in terms of kind of working with this as a parent and as an adult, kind of something you want to try to avoid is to punish the behavior. Sometimes that can be a natural response. But people who are self-harming, they know that the behavior is harmful, and they feel a lot of shame and they feel a lot of guilt about it. And so adding a punishment kind of just reinforces that shame and that guilt. I know that it feels complex and it's confusing, but I like to think of, if your child is walking down the stairs and you see them, they trip and they fall and they have this gash on their knee, you want to go be compassionate, and you want to help bandage it. You want to show them compassion and just really be with them and tend to them. And I think this is really not a different experience. It can be really, you can feel a lot of complicated emotions, but essentially what they need is just to know that you love them and you support them, and that you're going to help them just try to heal in so many different ways. Okay. So we're going to do a brief discussion about the brain. We're only going to focus on 2 areas. Anytime we talk about the brain, it's so complex and there's so many pieces that are going into it, but I want to keep it understandable. I think it's really helpful just to understand what is going on in the brain. So we're going to talk about the limbic system, which is responsible for the majority of emotional processing. And we're going to talk about the frontal lobe, specifically the prefrontal cortex. This regulates thoughts, actions, and emotions. So this is kind of a more in-depth. If we look at that center area, the purple area, that is our limbic system. It's right in the center. The limbic system has the amygdala, which is our fight or flight response. That is our brain's panic button. Anytime our brain senses that we are in danger, the amygdala is going to set off the alarm and our body is going to react. The amygdala, it's kind of a little almond-shaped piece. It lies right on top of the hippocampus. And the hippocampus is responsible for learning and memory, which is also very important. Lastly, we're going to talk about the prefrontal cortex, which is responsible for reasoning, problem solving, impulse control, and regulating emotions. So we have the limbic system, which is all about emotion, and then the prefrontal cortex, which helps with logical thinking and reasoning. So in the brains of people who are anxious or depressed, we see that there's heightened activity in the limbic system. In symptoms of depression, it can be caused by decreased functioning in the frontal lobe, so specifically that prefrontal cortex. So depression can cause the prefrontal cortex to become underactive, while causing the amygdala to become overactive. So feeling a lot of intense emotions, not a lot of regulating skills. So the overactive amygdala represses or inhibits the work of the prefrontal cortex, so resulting in the emotional part of the brain controlling the rational part of the brain. So a person will experience intense negative feelings and intrusive, uncontrollable negative thoughts. This is really what we're seeing when we see anxiety and depression. Why is this so important with teens? Because their brain is still developing. The prefrontal cortex is still developing and is not fully functional. It does not fully develop and fully functional until about early 20s. So the limbic system is also the pleasure and reward zone of the brain. This is fully developed, while the risk assessment part, that prefrontal lobe, is still developing. So just based on this information, this shows why it makes teens so much more emotionally vulnerable, and the frequency of mood swings is so much higher. Emotions are felt much more intensely, and this often makes them feel so overwhelmed. This is such a critical piece of information, just, if you're a parent or a teacher, but as a clinician, understanding when we look at these risk factors and vulnerabilities, if we have a child who is experiencing this emotional distress, and they don't have the skills to regulate or, being able to think past the current moment, they can respond to that in really dangerous and unhealthy behaviors. And so anytime we're talking about depression and any suicidal ideation, we have to take this into consideration, because they're going to act on impulse and not reasoning. And that's why I'm moving into this. Don't be afraid to talk about suicide. This is really scary. And I know that there was a presentation about some prevention techniques previously this month. So I'm not going to go into too much detail, but I do want to say, if you are concerned, if you think that your son or daughter might be depressed, if you're worried that they might be feeling suicidal, it is okay to ask them if they are feeling that way. I know traditionally, it was felt that if you were to ask someone, it would be putting the idea in their head, but that's just not true. And actually, it can often be a relief for that person to have an opening to start to talk about it. And so we do have 988, which is our new crisis line. You can call or text this number at any time, whether it is you who is in need of the service, or if you're really worried about somebody, you can access this. It's a great service. And just in terms of, sorry, just gotta move this over. In terms of kind of some of those assessment for risk, if you are worried about some suicidal ideation, you want to look for changes. So just like you're looking for any changes in their behavior for depression or anxiety, you want to look for those sleeping and eating habits. How are they doing in school? Are their grades slipping? Watch for angry outbursts, mood swings, loss of activities. Stay attuned to their social media posts. This one's really important. Your teens might not like it, but that's just a part of it. If you have a teen who has a social media profile, you should be able to see what is on it. There have been many lives that have been saved by people who were suicidal and made a post, and friends or family were able to see that. And that was a huge intervention. You hate for that to be a resort, but it is very critical. You should have access to that information. You want to keep the lines of communication open. Like I said, if you notice something, just ask them, start a conversation. They may not feel comfortable talking to you, and that's important to make sure they at least have an adult that they do feel comfortable with, whether that's a therapist or a coach or a neighbor, but just having that communication. You want to seek out professional support. If your child expresses any kind of suicidal thoughts, you definitely want them to be evaluated or referred to a mental health professional. You can talk to your child's pediatrician or a mental health professional, but they always need to be taken very seriously. And then, of course, in an emergency, if you have an immediate concern for a safety, just do not leave them alone. You can call the hotline, you can call 911. You want to make sure that you're locking up any potential ways that they can harm themselves. And really, you need to be with them in those moments. If they are actively trying to harm themselves, you want to take them to the emergency room to be evaluated and assessed and make sure that they're safe to go home. And if you are sent to the hospital, they will provide an evaluation. And if they do send you back home, they will send you with resources and a follow-up plan to make sure that you still have support, even if you're not admitted to the hospital. Okay, so our last little bit here, we're going to talk about treatment options. Okay. So therapy modalities, so cognitive behavioral therapy, CBT, that is kind of the approach used by most therapists. It is evidence-based. It is highly effective, both for anxiety and depression. This picture of our cognitive triangle, it talks about how our thoughts influence our feelings, how our feelings influence behaviors, and they influence thoughts. So it kind of is this repetitive cycle. The idea in CBT is that if you can change at least one of those areas, it can help change the others. So if you can adjust your thoughts, it can help to change into better feelings, better behaviors. It takes a lot of practice, but again, it's highly effective. For anxiety, exposure therapy is really effective. It is also a form of CBT. So anytime we're dealing with anxiety, the goal is to expose the person to what they're feeling so anxious about, and you do it gradually, you do it in steps, you make sure that the coping skills are in place, because we know that avoiding the behavior makes the anxiety much more worse. DBT, dialectical behavior therapy, that is also a form of CBT. That is a really great approach for pretty intense depression and suicidal ideation in teens. It really helps to regulate emotions, focuses on distress tolerance, mindfulness. A lot of intensive treatment programs will have DBT as a huge component. And there's also interpersonal therapy, art or play therapy, and group therapy. Group therapy for teenagers is amazing. I love doing groups. We know that for adolescents and pre-adolescents, that their peer group is the most important. That's kind of where they get their confidence. That's where they kind of learn who they are. So having a group of people with, you know, similar experiences, understanding this is what worked for me, this is what it's like for me, that can just have such a supportive and healing component to it. I'm only going to briefly talk about the psychotropic medication, but generally a combination of psychotherapy and some type of antidepressant or anti-anxiety medication is a really good approach. You don't have to use medication, but it can sometimes be a really good kind of stepping stone to get somebody to a place where they can be functioning in order to really receive some of the treatment that is available. Kind of the first line of defense in any kind of medication, a doctor would most likely prescribe an SSRI for anxiety or depression. That is a selective serotonin reuptake inhibitor. It essentially helps for the brain to be able to absorb more serotonin, because it is believed that there is a deficit of serotonin in a lot of anxiety and depression. Dopamine is another factor that comes into play, and that is something that you'll notice with the mood stabilizers. Okay. We don't have to go into too much details here, but I just wanted to show some of the different levels of care that are available. The farther down that you are, so counseling and psychiatry, that is going to be the least intensive. So that is going to be an outpatient counseling. You'll see a therapist once a week, maybe medication management once a month, every 3 months. That is going to be for somebody whose level of functioning is pretty stable. As you go up, so intensive outpatient, you're maybe going to meet with somebody 3 days a week for 3 hours a day. So moving up, we have partial hospitalization, which is going to be maybe 5 to 7 days a week, depending on the program, maybe 5 to 6 hours a day. So we consider this day treatment. So they're in program the entire day. They're learning these skills, getting therapy, and then they're able to go home at night. Then we have residential, which is where I started working. These patients live at the facility. They have 24-hour supervision. Just depending on the program, sometimes it can be 30 to 60 days. For the programs that I was at, they were there for sometimes a year, but pretty intensive treatment. And then we have inpatient, which is about as secured as it can get. Typically, those are pretty short length of stays. So if you have a child who is expressing some suicidal thoughts, if you take them to the hospital and they are evaluated and it is determined that they are not safe, they will be admitted to an inpatient facility, so an inpatient hospital. Seattle Children's Hospital is a pretty popular one. They will ensure that your child is safe. They have 24-hour supervision. There are restrictions. They're not allowed to have various items. So the primary goal there is to stabilize and make sure that they are safe to go home. Okay, so our last part is offering some support, and hopefully this will kind of open up some of the questions and answers. Let's see. So how can parents help with anxiety and depression? There are so many different things that we can do, but these are just some of the options. So you want to help your teen build strong connections. So much of helping with mental health and physical health is building a community of support. It is really critical that teens feel connected and that they feel really wanted and like they belong. We want to normalize mental health issues. There's still a lot of stigma associated with mental health, and I know a huge factor can be cultural or just your own experience in your family. It can be really hard to treat mental health the same way you would a physical illness. That's a really big reason why I like to emphasize what's going on in the brain. It actually is a physical change that we're seeing. It can be very difficult because from the outside, you aren't able to see it, but looking at the brain and understanding these things, it can be very validating to help understand. You want to be a healthy role model and practice self-care. If you are seeing a teen struggling with emotional regulation, you can demonstrate how you regulate your emotions. If you notice that you're getting really angry and heightened, you can say, I'm going to go take a walk. And you come back and then you can talk about what it is that you're feeling. This really enables them to have kind of a safety in talking about those things at home. Develop communication strategies. It can be really difficult to kind of bridge that gap for a teenager to try to express what anxiety or depression feels like. That very oftentimes is not something that they can really put into words. And so trying to create some sort of bridge between parents. I like to use a scale. So like 1 to 10, how are you feeling today? And parents can ask and they can understand, okay, they said they're at a 7, that means I can maybe leave them alone. If they're at a 9, that means I need to be with them. What I like about the numbers is that there's, no room for like misinterpretation. You kind of know where the other person is at. You want to try to help your teen identify their feelings. These are things that your teen will be doing in therapy, feelings identification, being able to identify these emotions. These are things you can practice with them at any time. It doesn't have to be if you notice that they're struggling, but just when we think about that teen brain and how strong the emotional center is, being able to identify the feeling will really help to increase their ability to choose an appropriate behavior. That's kind of the first step in really developing some of those skills that adults have. You want to provide support and reduce stress. If there's a lot of tension in the home, if you're experiencing a lot of tension, you want to make sure that you're trying to get your own help and your own support, because you want to make sure that you're healthy in order to provide a healthy environment for your teen. You want to, again, help them practice new skills. We want to reduce negative emotions at home as much as we can. And of course, we want to monitor social media. It's important to limit social media use and try to cut back on some of that screen time. We know in talking about kind of the serotonin and dopamine. So dopamine is actually released when kids are on social media, they're getting likes or they're getting positive feedback, it releases dopamine. So it can make them addicted to their screen. If they are already having a deficit of serotonin and dopamine, that is just a really bad mix. It's not offering coping skills, it is offering them a distraction, and that is not helpful. A lot of teens will actually acknowledge it. They don't want to give up their phone, but they will say, I know it's not good for me. So at least starting with, let's reduce some of those hours. You're on your phone 10 hours a day. Can we at least start with 5 and trying to work our way down? So lastly, what's the good news? The good news is that teens are resilient. Teens are incredibly strong. They are dealing with so much and they continue to thrive. We also know what works to really support them, and that is feeling connected, having strong bonds, and really feeling cared for. When I talk about all of these factors that influence anxiety and depression, I find it really critical to understand these are all the vulnerabilities. So how do we help prevent them from being so vulnerable? And if we know what's going on, that can really help us to tailor these interventions so that they're more effective. Okay, so that is my presentation. I hope that we can maybe open it up to some questions and answers.
Yeah, there's a couple questions in there, and I think you can access that, Chelsea. One, I think, is maybe for part of the people on this group. It's interesting. I work with a lot of elementary students, and I know that you talked a lot about teenagers, but what we're also seeing is this happening with younger and younger students. And so some of the things that you're saying, I feel what I've seen I work with the mental health specialists and various other things in our department, is that some of the same information, and maybe you can tell us a little about because one of the question is, what is available for younger kids, then who is aimed at that, who you're aiming that currently I'm actively participating for an incredibly specific reason, but my daughter is much younger than upper elementary. So I'm guessing littles, maybe K through 2nd, and needs help that I can't give her. And the mental health professionals just don't seem to be available for her needs, age situations. I've exhausted all options and I'm feeling really lost and helpless. And I'm really sorry that you feel that way.
Yeah. I know that this is unfortunately something that I'm hearing all the time. There are not enough counselors available, and these resources are just, that we need them and it's referred to you or it's recommended to you, but there's just, how do you access those people? A lot of these interventions and the things that I'm talking about, they can very easily be geared towards younger kids. And something that works really well with even what Tanvi was talking about is kind of the mindfulness, the belly breathing, and you can make it really creative. I actually have a really great resource that helps talk about these different areas in the brain, but it actually is geared towards younger kids. I can share that with you. Let's see.
You can use the chat for everybody.
Awesome. Okay.
That's the easiest way to do it.
In the meantime, just to answer that question aloud as well, I think there's also coping strategies out there, but the district is also partnered with Cara Solace, and if you can talk to them, they can recommend you to certain counselors and certain therapists that can help in your personalized mental health journey. And one of the best ways you can contact them is by going through your teacher, the student's teacher, and being able to help that way. It's also on the NSD website as well. I can put the link in the chat.
Yeah, actually, I just looked that up, Tanvi, so I will throw that in there for everybody. Thank you. I was going to tell everybody that I want to do a plug for that. So, Chelsea's so right, and so is Tanvi. We have very limited resources in what are anybody dealing with our mental health supports in our schools, because we do have mental health specialists in all the elementary schools. So that may be one place you want to start, if all the elementary schools have that available. So speaking with the counselor and maybe getting a referral for your student. It's getting to that time of the year and they don't work during the summer. So this is where Care Solace might really be great, is you can go into the website, and I just put the link on there. You can go through your counselor if that's how you feel more comfortable at your elementary school, or you can go in and put the information yourself. Care Solace, what they do is they do all the matching. They do all the hard work and time for you. So instead of you being on hold for an hour, trying to find something that matches your insurance, or maybe your child wants to speak to a female or male, depending on, what their needs are. You can go into Care Solace and then you put in what your needs are. So for example, you would want somebody that works with smaller children. You may want somebody that works with somebody who has had trauma. You may want somebody, it sounds like you're having some very specific issues. So you could tell them that. And then what they're going to do is connect you with a therapist that meets your daughter's needs. Work if you have insurance, or if you don't have insurance, they'll work on a sliding scale. But it's really a fantastic resource. So I highly recommend it, especially if you're struggling finding those resources. And don't give up, because sometimes, and I'm sure Chelsea will tell you this, and I'm not sure if Tanvi's gone through therapy, but sometimes it might not be a good first fit, or sometimes your student just may be in there just not saying a word. And I work with the mental health therapists in the district, and they tell me that all the time. They need sometimes 4 to 5 weeks just to build that relationship piece, and for the student may even to talk to them. So anyway, I hope that resource supports you, or at least gives you some kind of pathway to move on to. So thanks for bringing that up, Tanvi.
Yeah, and I completely agree. I've used it, and I've had such a quick response. I've had kids come to me and say, I've been on the wait list for 11 months. And so connecting them with Care Solace, I've had them be connected in within 3 to 4 days. And that is huge. It's been really amazing. So definitely would recommend it.
I also want to mention too, I know I sound like a Care Solace commercial, is we may have people on our webinar, I'm sure we do, that are maybe English as their second language, or they have a culture that they want to have supported during their mental health therapy. For example, maybe you want somebody that understands your culture. That's also something that they can do. If you want to be real specific, like you need a Spanish speaking therapist, you want a therapist that maybe is Indian or understands Indian culture, or maybe understands Hispanic culture. So that's also items that you can put in, that they can connect you with somebody that you feel is going to support your family.
There was a question in the chat about like if you have someone like a child that's going through like feeling lonely and alone at school without friends, and like I feel like even though I have so many friends as well, it's really hard to be able to feel included all the time. And for those who don't have friends as well, and it's really hard to make friends, something that I personally use in my daily life with my family is being able to have like supportiveness in the family and community, where you do like family game nights, just so you feel like you belong somewhere. And if you feel like you belong in one place, you become more open to even like talking to more people. Or even if that's still hard for you, like that completely makes sense. Being able to have those things and being able to see, okay, maybe I like playing Minecraft, and like going to school and seeing if there's any Minecraft clubs, or even being able to bring a computer and play those games, or like read a book and find what you enjoy. So when you're in school, seeing all those people can be really hard, because like they're all talking and you feel lonely. But being able to say, okay, what do I enjoy, rather than ignoring what everyone else is doing, what do I enjoy personally, and going based off that. So like being able to at least feel included in one community, your family, is always going to be a lasting relationship. So I think that's a really good starting point.
And there was a question asked a while ago, the stigma is real, as we all know. How can I help my child cope dealing with stigma during their recovery from depression and anxiety?
Yeah, the stigma is real. And I think something that can be helpful just in terms of recovery, like when we talk about groups, understanding that so many other teens are going through what they're going through, or younger kids are going through. So finding, if you can, maybe support groups or other resources, even if it's an online resource, and helping connect them to other people who are in that same experience. I think it can be kind of a delicate situation because they don't want to be too forthcoming if they don't feel comfortable sharing some of these things with like their average, peers. But really, I think being able to find that community and having a space where they can really share this information, and again, just feeling really supported. So finding support in that, and even just finding resources for yourself. And as a parent, there are a lot of parent groups, there are parent communities, and just kind of finding other support in that community as well.
All right, we have, how do you support a sibling of a teen with significant anxiety whose anxious behavior takes over the home life atmosphere? Sometimes we know this is it becomes a family issue because one child or person in the family, doesn't have to be the student, child, it's affecting kind of everybody's family life.
Yeah. I would definitely encourage open communication with that child. I would check in with them because the impact of having that in the home is going to certainly make them feel anxious, make them nervous. I think it's something that we do see a lot. If you have a sibling that's really struggling with emotional concerns, is that the other child might tend to feel kind of ignored, or they might try to kind of suppress some of their own feelings to try to stay out of the way. And so I think just having really intentional conversations and saying, hey, I'm just here to check in. I know this can be scary. Are there things that we can do to maybe help you feel safe? Can we find some support for you? I think just making sure they know that they are still really important. And if they're feeling really scared in the home, like depending on how severe the behavior is, it might be helpful for them to have kind of an option to go to a friend's house, or just kind of have some respite and try to eliminate kind of some kind of secondhand trauma or any intensity, especially if you're dealing with a lot. It's hard to also be navigating a second person. So I think the most important thing is really just emphasizing that their mental health is still a huge priority, regardless of, you don't ever want to compare the two, but just understanding, like, we want to make sure you feel heard and you feel safe.
Chelsea, is it typical too that if one child is getting therapy, best practice is that it should include some family therapy as well to work on some of those things, but I'm not sure if everybody does that, but that may be something too to work on those. I am not a therapist, I'm asking a question.
Yeah.
Is that a thing to work on for family dynamics? And
Absolutely. I think anytime, even some of the older teens, it can be a bit more challenging, but especially with younger kids and even middle school, I always try to incorporate the parents, because what they're learning, especially if you're doing CBT, they're going to be doing a lot of homework. And so we want parents to understand these are the things that we're working on. We really need you, because if they're going to counseling, that's 1 hour a week. But really, the parents and the people at home are the ones that are going to be practicing this every single day. And they're practicing it when it really matters. And I think it's helpful for parents to understand, how they can really support, because I think they want so badly to help, but often feel like they don't have the skills. And so a big part of that is really empowering them to help in the session and just continue to build the bond with parents. So I would love, and I do encourage like families to be incorporated as much as they can. With siblings, you would want to keep that separate, but certainly having a parent be incorporated, that would be really critical.
all right, any other questions? We have some people commenting on thank you for having us, and they forgot that they needed a reminder about Care Solace, but you know what? I'm glad you found somebody. So if you found somebody and then you learned about Care Solace, I'm just glad you found somebody. So I know I'm in the Edmond School District, and when my daughter graduated during COVID, which was, if you have a kid that graduated during COVID, it was really hard. She really struggled. I think that that kind of that morning of losing some of those fun high school traditions, prom and homecoming and those traditional ways. We did have it in our garage, in our backyard, but not the same. Anyway, that's how I learned about Care Solace. They were using it as well. And we were using we were going through Care Solace, and we were going through our pediatrician, and our pediatrician, we ended up finding it faster. To me, you just have double the resources, and that's awesome. And whoever you can find first, that's fantastic. So, of course, reach out to your pediatrician for those resources. But then if you're getting put on a wait list, please, please, please try Care Solace. And that way you kind of have 2 avenues going, and whoever gets there first is, that's going to be for you. Let's see. It says we have a kid in 4th grade who has fussed about homework and hard times focusing, and often ends up melting down. It looks like Tanvi's going to answer that question, but you may have some other pointers too, Chelsea.
Chelsea, do you want to go first, or should I?
No, go for it. You go, Tanvi.
Okay. Thank you. So I definitely think being in 4th grade and having the homework all of a sudden coming newly and being able to deal with all the stress is really hard, especially when you have more fun. And at that age, you really just want to like get out and have fun and play in the nature, and just being able to have that homework is really stressful. What personally helps me is like when I set this time, I'm like, okay, for this long, I'm going to work, and then I deserve a break or take a snack, like go out for at least 5 minutes and just distract your mind. But also when I'm doing homework and I have no time to take breaks, I'm like full focus. What helps me is if I'm really stressed, like there's a test tomorrow and I'm not able to focus and I'm like scared and getting all those negative thoughts, that's stopping me from being able to study, but also making stress, like it's more stress for me building up. I typically do square breathing, and like being able to, since I can do it during work as well, like in my head, just imagine it. If I'm like writing down things for like a math test next day, I'll be able to in my head like imagine a square along the first side, breathe in for 4 counts, hold for 4 counts, breathe out, and then hold again for 4 counts. It's something that really helps me to just refocus and concentrate. Another thing that helps is being able to, like, if I have questions, trying looking them up online and asking.
We lost Tanvi. Oh, we lost you, Tom. You got to say the very last sentence. You froze.
I'm sorry, what did I say last? Was it the square breathing? Was I talking about that then?
Yeah.
Okay. Yeah. So just being able to have those breathing techniques and have coping strategies, I think is really important. And also looking to see like what coping strategy works for you, how much time you have designated. You may have also heard the Pomodoro technique, where they like set around 20 minutes for work, 5-minute break, and then 20-minute, and they do like that to break off their work. So it's not full on stress mode and having to do so much work. But I'd love to hear from Ms. House as well to see.
Thank you. I think it's great to have a kid's perspective on this. I think it's really important because sometimes, as Chelsea's the expert, Tanvi's living it in the moment and has that identified teens. I have teenagers myself and have dealt with anxiety, but I think that's really important to have all these voices. And I will say, I know the person who said, this is the stigma is real. One thing I think it's, we always look back, like I think, oh, my, growing up was the greatest because we didn't have social media. We had to pass notes. It wasn't, the bullying was very different because we didn't have social media. But then I think really how lucky kids are today in the sense that we are so more open about mental health. It's starting to lessen as a stigma. I think in some communities it can be more of a stigma. But I think working all together and talking about mental health as being a true illness and understanding it as an illness. I just feel like kids are, in a way, yes, it's harder. I agree with many of these people, like we're getting kids younger and younger and things like that, because there's just different impacts. But I do feel like we're in a lucky age where we do have the supports and the understanding around it. I mean, schools even 4 years ago did not have mental health specialists in their schools. And counselors, I don't think were really equipped to deal with with this. And now we're all starting to, even teachers, and Tom V, maybe you can speak to this, but even I think not all the teachers, but some teachers starting to recognize that starting the day off with a check-in, for example, for students on how they're feeling, or recognizing that students aren't ready to learn until they're regulated, or maybe are in a good place to learn, and talking to students. So that's the other thing. If you have a student that's really struggling, like going into class, or and this is any age, is really maybe talking to the teacher and advocating for all the students to do a check-in and a social emotional check-in at the beginning of class, starting out with maybe something kind of more fun, calming. I've even seen secondary teachers use the bowl where they clink, do the relaxation and meditation. We've seen a lot of really good things with that, setting an intention for the day and doing that throughout the day. So there are things you can advocate in the school, and don't feel uncomfortable advocating for that, because other parents will be very excited that you're advocating for that. I bet you'll find 10 other parents in your class that would love for that. So we try to advocate for it in student services, but sometimes that's the trickle down method. So sometimes that ground up support from the parents or the students of asking for regulation, check-ins, support with their social emotional well-being is really, really important. So let's see, we answered that. And then another person asked, is it a sign of anxiety, which we should address, or could it be anxiety due to a lack of executive functioning skills? That's a challenging one, Chelsea.
Yeah, it's a great question. And that is very challenging to be able to kind of assess just based on symptoms, because so many of these things have just overlapping kind of presentation. So it might be that it's anxiety and there's some limited executive functioning, but that also, I don't know, I guess sometimes when people ask about like a specific diagnosis, or like, should we look at this, or should we be looking at this? Essentially what we want to look at is, okay, well, what kind of treatment can we just offer? So if we're looking at how do we treat an executive functioning deficit, or how do we improve executive functioning, a lot of those skills are going to be pretty similar to helping navigate anxiety or navigating ADHD. So you can really tailor your interventions to the executive functioning. So I would say you want to be really aware, and if there is anxiety, we can focus on that. But also if there's executive functioning deficits, you can also focus on that. I don't think we need to necessarily get stuck focusing only on one. There's a lot of different ways that we can kind of add more and more help. Hopefully that makes sense.
Yeah, and if you do feel like it's an executive functioning, that's also something to talk to your student's teacher, and they could go through the guidance team process at your school. And it might be because executive functioning, if they could have a disability in regards to their executive functioning. So that would be then, and I'm not saying this would be the case, but this might be something to discuss with them, is it a IEP evaluation, which is a special education evaluation. And that's also another stigma sometimes with people as with special education, because many special education students are getting supports through the special education process with social and emotional issues, such as executive functioning. It may just be a 504 in place to work on executive functioning skills. So it is, like what Chelsea said, it's a fine balance, but it is a good question to ask your the teacher, if they're not really sure about it, especially if they're maybe a newer teacher. You may want to schedule an appointment with the counselor, and they'll be able to talk to you pretty strongly about, maybe what they're seeing. And it's a team decision. So everybody decides and looks at all the data. So it's not like a, hey, this is what we're going to do. So I think that's really important to look at too with that. Because if they're having if they do have a disability as far as their executive functioning, that in itself could be causing the stress and anxiety, because they don't know they're not getting those supports on how to work through and learn how to use those skills. So, all right.
One thing I'd like to add about what you were saying before, Katie, is so for mental health in schools, like as a parent, something that you can check in with your student is that like if any other student of their peers check in with them about their mental health, because that's something that like on a daily basis, like with my friends, like they say they're stressed about this and anxious about that. Like it could be low mental health challenges, but they're still important. And like as a team, being able to hear other people sometimes can put me in a position like how do I help them, and like do I need to give a therapist contact or a counselor, and how can I help in that way? And like that's a lot of stress as a student. Like I don't get usually, but I know a lot of my friends from other friends get a lot. And it's hard to be able to contain that as well as your mental health as well. So I think being able to check in with your student every now with your child every now and then and say, did anyone contact you about mental health? And if so, were you able to handle it? And is there any way I can help with that as well? Because I know that's a challenging situation. And yeah, being able to do that. And also in school, sometimes like Katie was saying, it's hard for teachers to be able to identify things in students unless parents really bring it up. And I think that's a really big thing because in our daily lives, teachers see a lot of students going through their days and may not be able to take time to look at those signs and symptoms, but being able to yourself ask the teacher and let them know beforehand, it can really help the teacher's life, but also help your own child's life. So just wanted to say that. Thank you.
And it says, and this is something I see a lot with the online program. I support the online NOAA, which is the North Shore Online Academy, both elementary and secondary. Is we see school refusal both at elementary. We're seeing that as early as first grade. And then we see it really predominantly there's a lot in middle school, and then I feel like in high school there's spatterings of school refusal. And honestly, this one perplexes me. Unfortunately, we don't have a system where a student can really go part-time, because it would be nice if they could just go in for a few classes, maybe. We do, I'm going to put in a plug-in for the online academy, and it isn't COVID learning, it's so different. I can put that link in. We support several kids with school refusal, and the idea is to start them off in online and then to baby step them back into the classroom. So build up their confidence around school, build up, sometimes it could be, where the kids are at, either hormonally, so if they have mental health issues, and then you add on the layer of puberty, and then you add on the layer of hormones. That's what I see. Chelsea, correct me if I'm wrong. It kind of creates this, and add in cyberbullying or social media and all those kinds of things. It's hard. So I'll put in the link for that if you're interested. We serve a lot of kids with school refusal, and we found a lot of success with it. I know you really probably want your kid to be going into real independent school. For high school, there are some small options though, which are really good, which is SAS, which is Secondary Academy for Success, Innovation Lab High School. And then for middle school, we still do have North Shore Networks, which is a very small school environment. So sometimes that can help baby step your student into school as well. So I'll send you the page for those. I don't know, Chelsea, do you have anything else about school refusal? I feel like that one perplexes me to no end.
I think this is a really big one. And I feel like even when we're talking about kind of symptoms and signs of anxiety and depression, it's almost like we kind of want to add school refusal in there. And I think we're seeing so much more school refusal than we have in the past, just especially like post-COVID. It just really disrupted so many things. But when I am working with students who have pretty strong anxiety about going to school, you really want to try to focus on kind of that exposure type of response. So the ideal approach is to try to set them up with realistic and attainable goals. So if they're having a really hard time going to school 5 days a week, let's set up a plan where maybe they go on Monday for 2 hours and then they get to come home. Or we start out a plan where they go to their 6th period class. So it's kind of like these building blocks so that they feel more successful, because I know in an anxious mind, they're going to feel like, oh, I wasn't able to go to 1st period. I can't go to 2nd. I can't go tomorrow. And there's just this spiral. So it's almost like you want to reset and say, okay, what can we do today? Let's go to 1st period. If you need to come home, you come home, but you made it to 1st period. And so we're building on successes. It can be very challenging. Obviously, it's easier kind of said than done, but it is more effective, and it helps them build confidence and working on these positive steps.
Do you have any tips for getting support for highly capable students who may look like they're performing well, but are highly stressed, not sleeping, or maybe partially masking being twice exceptional? I'm just going to start off with saying I supervise a mental health specialist at elementary, and we specifically discussed this yesterday. Is it twice exceptional? And the stressed out, anxiety, things like that. So one of the things you need to know is they are planning to support at least the teachers. They do support the students, but providing training for EAP teachers to support their students with these situations. So trying to help the teachers intervene at the beginning and do their classes where they understand that this is happening to a lot of their kids. So we're hoping that doesn't really help you now, but that's something they really want to do, and train the teachers for next year so they're better supporting it. And then I'm going to let the other two experts take it away, because that's all I know about that one.
Sorry, I got distracted by some really amazing questions. So this actually kind of ties in. So in terms of like getting support for these highly capable students, so you're noticing that they're having trouble sleeping, they're very stressed. So I think really having an open conversation and trying to prioritize that basic self-care and say your grades are phenomenal, you're doing great. Obviously, teachers aren't going to be concerned because they're not seeing it. I mean, we see this all the time. Kids are doing great at school. They get home and they completely break down because they've exhausted all of their energy and resources keeping it together at school. So if you're seeing this at home, it's also important to really work on that self-care at home. And if there are steps to take so that school can be less stressful, I would coordinate with the school counselor. There's a lot of accommodations, and I know it can be challenging if they are doing well, but being able to really advocate and say, this is what we're seeing, and really just kind of speaking up for those aspects. Those are really important. And then there was also, oh, maybe it went away. Oh, here. So appropriate nutrition and sleep cannot be overemphasized. Absolutely. Sometimes, actually, whenever I first meet with a new student or somebody, I go through those basic things. How much are you sleeping? Are you eating? Are you drinking enough water? I cannot tell you how many times the answer is, oh, I haven't had water in a couple days. The last time I had a meal was a bag of Doritos. The last time I slept for about an hour. Okay, so let's regulate all three of these things, and then we can assess for, some other stuff going on. If we can at least regulate some of those, it's going to make a huge difference. And I know I didn't go into it for the presentation because there's so much to cover, but just a lot of really natural kind of approaches with mindfulness, yoga, exercise, healthy eating. Like, these things are so critical. And I know that teens don't necessarily think that far ahead because they just want, kind of what's good in the moment, but really helping to educate, and again, kind of being a role model and demonstrating healthy eating and healthy exercise. Okay, we go to sleep, let's turn our phones in. Those are so critical. So thank you to the person that mentioned the nutrition and sleep. That is really, really important.
sorry, I keep muting myself. There have been quite a few, a couple questions about disordered eating. So that is something we've been trying to get in as well. Right now, and I don't know if you have some other resources, Chelsea, I put in the question and answer about the Eating Recovery Center because it is fairly close. And I've had several students go through their program successfully. I know ARFID is a really, really big thing right now. Not saying it's just like a fad, but it's something that's actually people are diagnosing. I think it's been around for a really long time. And I worked with a student last year that went through Eating Recovery Center and we supported him academically. So that is someplace to look. I don't know if you have some other resources, Chelsea, for that, but we would like to have somebody come and actually speak about disordered eating as well.
Yes, I think most of the resources that I'm aware of are pretty intensive, which usually they do need to be pretty intensive with any eating disordered. Sometimes you can find like an OCD specialist, and they can work really well with some of that, the thought process that goes into that. Yeah, I know Pathlight Mood and Anxiety has an eating disorder center.
I think they're kind of tied together some way.
Yes, so they have like a mood, and then they also have a separate unit, but it's been pretty successful. I think the Emily program is one that I've heard of. I believe it's an inpatient, but it does treat eating disorders. Yes.
All right. Should I be worried about long-term and I don't know if you can answer this because unfortunately, we're not doctors. Should I be worried about long-term dependence on psychotropic drugs?
Yeah, as I
that.
am not a psychiatrist, and so I cannot, confidently say yes or no. I can say that just at least what I know about anxiety and depression meds, so like SSRIs, just the way that they work, there is not kind of that immediate release. They're the way that they're prescribed, they're so slow to go off of and so slow to come on. It is very unlikely. And I don't, just because of the nature of how it works, there's such a long, for them to take effect, it can take quite a while. And so we don't see that with other kind of drugs that are more dependent, where you notice sort of like a stimulant. So for maybe like Ritalin or an ADHD medication, I would be more concerned about dependence on those because there's an immediate effect. But as far as just the antidepressant medication goes, those have a much less likelihood of becoming dependent on them. But I would definitely ask a doctor. That is, yeah.
In 504, for a student with an ADHD diagnosis who's currently doing well but working really hard to maintain. So just because a student is doing well in school doesn't mean they don't need accommodations for things. So what you can do with that is, first of all, with a 504, if you go to OSPI and go 504, it'll have all the parent information there for you. And if your child is on an ADHD medication and that is keeping them working well, they can still be on a 504, because without that medication, they may struggle with the ADHD. So that can't be like, it can't be like, I'm trying to think of the word, but the accommodation can't be built based on the medication. It's just like depression or anxiety. If a student's doing well when they're on medication, if they choose to go off that medication, we still may have to have a 504 in place for those accommodations, because without the medicine's kind of like I don't want to use the word, it's not a crutch, but like I don't know what they use in 504, I forget. But basically, if you know your student is ADHD, what you do is you want to bring that to the counselor at your school, and then as a team, they decide if a student needs it with you. It's a parent discussion as well. And if your student, I would encourage, if your student's secondary, to also be a part of that discussion. Because I think it's important that students start having a voice in that. It goes really quick secondary school, and they may feel that they need it or not need it, and they're the best ones sometimes that know. So and so that's the way I'd go around that, is just reaching out to your counselor about it.
I see this question, should we consider an anxiety attack to be an emergency situation? Is this something we should call 988 for? That is a really good question. And I think if it kind of depends on the severity, if you know that it is an anxiety attack, if you have a child who has been diagnosed with anxiety and you understand this is what's happening, there are ways to kind of regulate that and work with that. I think initially when it kind of gets started, if you're having an anxiety attack, it genuinely feels like you are dying. And it might be just a natural response to say, we got to take this kid to the emergency room, get them assessed. And they might say, okay, nothing's wrong. This was an anxiety attack. That's not always the case. I think a lot of the mindfulness, the deep breathing, if you can kind of help them regulate some of that breathing in the moment, that's a really good indicator that it's an anxiety attack and not something more severe. Generally speaking, anxiety attacks, they can be managed at home. I have a lot of kids with pretty intense ones, so much that they hyperventilate and they can make themselves sick and they might start to vomit. Even those can be managed at home. It's a very scary thing. But also being able to keep them in a safe, kind of secure environment at home can be helpful, just to not kind of exacerbate the symptoms and the intensity. But I mean, you could certainly call the 988 number and just say they would be very knowledgeable about how to provide kind of interventions in the moment and help you kind of facilitate some of those deep breathing activities and helping with that.
Tanvi, did you have any additional information on that as a person who may or may not have had an anxiety attack?
No, I'm not quite sure like exactly that feels, so I don't want to talk and get something wrong. But like just being there for the person and like trying to be able to be calm as well for that person is really important. But I don't think I can say anything more than that. Thank you.
Yeah,
I
think it can
finding the breath.
Yeah, it can be really helpful. Even just if you know you have a child that goes through these anxiety attacks, you can do some research, because when we talked about the limbic system and the amygdala, so there is our body does the same thing whenever it feels like there is a threat. So understanding that what that panic attack, what is happening is just a natural response to kind of this cue in our brain that may be misfiring. If we understand, your stomach's going to hurt, your heart's going to be racing, your breathing is going to start changing. There are very specific techniques that really help with those, and it can help kind of reset the process of what's going on. There's some pretty amazing kind of trauma-informed work where we talk about the vagus nerve, and that can help reset and help regulate the nervous system. There's a lot of really great research. I would encourage you to look into some of that, and there's a lot of very simple videos that you can find on YouTube about regulating the nervous system. It talks about our window of tolerance and just really skills in the moment that can help kind of the biological part of what's happening. That can be really, really profound in those moments.
I'm answering this question right now, but I wondered if either one of you had more resources. And I'm going to suggest also, I don't know the age of the student. It sounds more like elementary, but I think this is a good question maybe for you, Tanvi, too, is if a parent, because sometimes we're at an age where we think our parents don't know anything, and or we're so upset that we don't want to listen to our parents, or maybe we see them more as a different type of, what do you know what you're talking about, is how do we convince people? So when you're out talking and things like that, how do we convince kids or anybody having like an anxious time or getting all upset or whatever to try to dysregulate? How do we get them to breathe if it's hard for us? What kind of resources do you tell other people for those breathing or getting people calmed down? Like if the parents can't do it.
Yeah, so in like a situation where parents are trying to be there for their child, but it's also like hard for that child to understand the parent, but being able to bring that calm space. I think what really helps is like first taking a breather, like everyone just relaxing for a moment. And then maybe like what my mom actually proposes is doing I think it's called EFT tapping. That's what we all do like when there's this heated situation in the house and like we don't want to listen to our parents and then it's just getting really hard to be able to communicate our emotions. We all just take a moment and do 5 rounds of tapping. And like where we do this, then go through like each place 5 times. This tapping technique really helps. I'll put more more information on it in the chat. But being able to do this is like we're all coming together, not talking, being able to like focus our emotions again, refocus. And then after we do that, like every time we do that, I feel like either in the car and we're all having a discussion and it's getting hot, being able to do that in that moment. After we do that, I always notice we're more calm, we're more able to clear our judgment and just more focus on like what's going on, being able to hear other emotions as well. And especially like after that, I'm able to more understand my parents because I'm not going the defensive mode. I've kind of relaxed that defensive mode down and being able to openly listen and be like, yeah, here are the emotions I'm going through. Because when you do that tapping, not only does it like calm you and refocus, it also makes you think, hey, I'm going through this emotion, diagnosing it and taking that moment to like acknowledge your emotions, being able to share it after that can really help.
And I know too, my daughter, I'm laughing because somebody said they aged themselves with listening to tapes, but great reminder. I mean, it can be a tape if you still have that. Maybe you have your old, what is that? The portable CD player, whatever. But I know when my daughter and, younger kids can do this too, is especially if they have an iPad or something like that, is you can put an app on there that has like, I know for a lot of people, like maybe listening to a podcast or listening to weather sounds. Maybe they like the sound of rain. I know we get that all the time here, but maybe they like the sound of a babbling brook, or maybe there's, just any sort of app. And so they can just go listen to their app. And I know that really helped my daughter too, is she could just go in her room and just kind of calm herself using her app. I mean, it has to be up to the student what they like. I think, everybody's different. I love the tapping idea because I love that your whole family's doing that. So that goes back to Chelsea's modeling. Your mom's modeling that with your family. It's not just like, Tanvi, do the tapping exercise. You do the tapping. You do your breathing. It's all of us. I'm gonna model the breathing. I'm gonna model the tapping. Then we're all going to talk together, because guess what? It's okay. I get heated too. So I think thank you for bringing that up, anonymous attendee. We are running out of time because it is 8:00. I can't believe it. I'm glad we had so many times to answer questions. I know some people have been adding in about like nutrition and how food can affect you. And I totally agree. Again, I think that's really, we need to get somebody that talks about it, because that's not really disordered eating, but it can be because of the nutrition and how it can affect different, different chemicals in foods, especially if you're eating like flaming hot Cheetos and Mountain Dew every day. That could definitely affect your mental health. No offense against it once in a while, but I'm sure Chelsea and I see, well, especially at the high school level, it was crazy what I'd see with kids for breakfast every morning. So thank you all. I want to do a round of applause for Tanvi and Chelsea. Thank you all. I also want to congratulate this group. We had the biggest turnout of Mental Health Wellness Month. So thank you. This is obviously something very important to our community, and I hope we continue the conversation. And again, just a reminder, we'll be sending out information about Tanvi and the other 2 students doing a student. I think that's going to be definitely focused towards intermediate element. Do you feel like that's a good place, like 4th and 5th grade, Tanvi? Do you think that'll be?
I think maybe like elementary school to middle school. I think that'd be a perfect group age.
Yeah. And then the other 2 girls are from high school. So we'll get it figured out, because maybe it's high school first and then the other grades next, whatever. I know they don't have a 90-minute attention span usually for these kind of things. The other item that I wanted to remind everybody, because a few people asked, is we will have this posted on our North Shore. We're building up our North Shore Resource Mental Health Library. So it's North Shore School District. It's right on the front page right now for mental health resources. You can find out about Care Solace there. You'll see the videos from all the things we've done for mental health this month. And then we're building up that library. I put my email in the chat. I'm the only Bjornstad. You can see my name on here. I'm the only Bjornstad in the district. Please feel free if you have feedback, suggestions, anything that, and we'll vet it first, of course, because we have to. But if you have suggestions or ideas of things that you would like to see, please let us know, because this is a community event and we want to be able to support the community. So thank you all. And again, thank you, Chelsea and Tommy. You guys put a lot of time and effort into this, and I so appreciate it.
Yeah, thank you.
All right. Thank
Thank
you
you
all.
so much. This is amazing.
Yes, it is. And I will see you next week, Tanvi.